right into operating rooms in our area. Fios 1 and the Journal News with a special report on Robodocs, multi-million-dollar machines that are performing surgery. Here's Fios 1's Ray Raimondi.
This robot is single-handedly revolutionizing healthcare and the way surgical procedures are conducted at hospitals across Westchester and the lower Hudson Valley.
So what the robot allows is much more complex operations to be done minimally invasive.
This robot, identified as the state-of-the-art Da Vinci Xi, the robotic surgical system. Its cost, an estimated $2 million. Its robotic arms, the high-definition 3D screens, and its newly designed range of motion.
This is quite remarkable and revolutionary, this technology.
Definitely. The robotic surgery boom is something that has been developing for about a decade now.
Journal News health investigative reporter David Robinson has been looking into lower Hudson Valley hospitals, including Phelps Hospital in Sleepy Hollow, using this latest technological phenomenon. So here's how it works. The surgeon sits at a console and then uses hand controls to maneuver robotic arms while viewing images on the inside of the patient's body. Those robotic arms contain endoscopes with a light and camera attached to them, providing surgeons with the vision, clarity, and precision like no other.
It makes it safer. The patients have smaller incisions, their pain is less, and they get out of the hospital sooner.
Robot surgeries are used for minimally invasive gynecological, urological, cardiac, thoracic, and general surgical procedures. Phelps Hospital received their Da Vinci Xi surgery robot back in the spring, and over the last 6 months they've operated on 50 patients, and it seems like the robot procedure is growing in popularity.
Recently I had robotic colon surgery.
Northern Westchester Hospital also performing the robotic surgeries with the Da Vinci robot, and those who chose to have the robotic operations have nothing but praise.
By the next day I was up and moving around, walking around, no problem.
The robotic surgery typically costs $600 to $1,500 more than traditional procedures. And yes, there are risks. According to the FDA and the robot manufacturer, between 2000 and 2013, there were 8,000 device malfunctions with robotic surgeries, 1,400 patient injuries, and 144 deaths. During those years, for every 100,000 robotic surgeries, 83 deaths or injuries occurred.
There were some pretty striking numbers as far as some of the research into some of the complications that were out there.
But new innovations with the Model Xi have been made with an even stronger emphasis on safety and the FDA's required maintenance of the robot. But the ultimate question, will it become mainstream? Medical professionals predicting robotic surgery may possibly be the standard within the next 10 years. In Sleepy Hollow, Ray Raimondi, Fios 1 News.
Phelps Hospital, part of the Northwell Health Network, is just one of about a dozen hospitals in the tri-state area that uses this new technology. You can learn much more about the robotic surgery in the lower Hudson Valley. Right now, just go visit lowhud.com and see a full print report that will appear in the Journal News this Sunday, November 5th. In Ray's piece, we heard from David Robinson, an investigative health reporter for the Journal News and LOHUD, and David joins us now. It's interesting. I think it's stated clearly there's been an explosion here in terms of robotic devices being used, certainly in our area. And you said there's even more of a, more than just an explosion of them. It's also their uses, where before it started off with urology and gynecology. Between 2009 and beyond, it kind of got into general surgery, and that's where we're seeing, obviously, the multitude of these procedures.
Of course, yeah, that's really the big breakthrough for the robotic surgery, and when it really delved into the general surgery fields, like the surgery that we focused on, the hernia surgeries, the thoracic surgery, where you're talking about going 200% increase in number of procedures globally to 570,000, and when you kind of put that into context to where it was in the past, it's putting it into every different field of surgery that makes all the debate that much more important.
And I want to get into some of the debates. On the positive side of the ledger, from the story of that patient experience that you described in your piece, what would have been a much longer scar, what would have been a much more longer inpatient procedure, rehab, etc., that time cut down, the scar cut down in size. There are real benefits attached to this, and you were even telling me before we began the interview, there are some procedures, some extremely technical procedures that a robot can really only do as an extension from a laparoscopic kind of thing that weren't heard of 10, 15 years ago.
Definitely. When you're talking about recovery times of months, 2-3 months versus a few days, that's a huge leap in kind of the limiting of pain and the amount of time that goes into the kind of getting back into your normal life. And that's really what the surgeons will tell you is their main goal, is to kind of cut down that kind of impact to the patient. And that's where you get into the minimally invasive aspect of this. So is that they're making these, tiny, millimeter measurement incisions, as opposed to cutting somebody from, stem to sternum, as they used to say. When you're having a huge open wound, there are so many more complications that come into it. So that's when you start talking about, when there's a highly complex surgery that previously you couldn't do without the robot, and now you can. That's saving lives, really, when it gets down to the bottom line.
Now, I'll get to the safety and the oversight here of this new phenomenon, but how about the cost, the dollars and cents? Talk about how much of a variation is if you go down the robotic route. And I know the prices have come down in recent years, but what are we talking about?
Yeah, so the experts, they'll tell you, depending on the procedure, there can be pretty big swings whenever anybody goes to the hospital. As anybody who's gotten a bill, they can, sometimes the sticker shock can really set you back. But, overall in general, they're saying $600 to $1,500 more for a robotic procedure versus the traditional laparoscopic, when you're talking about kind of a basic level. When you're talking to the complex, it's difficult to really compare apples to apples to some extent. But when you're talking about cost, you also have to bring into the equation the cost of what the hospital is spending to bring the robotic device to the operating room. So you're talking, a $2 million device that can only use some of its instrumentation 10 times before it has to re-up and renew. So I mean, that's an ongoing expenditure that kind of puts a strain on the economics of healthcare.
You mentioned the debate, certainly safety and oversight are part of it, but also not all procedures, there's not unanimity within the medical field that you need to go the route of the robot here for a lot of these. And that if you did in the more traditional sense, there'd be a cost savings, but that might be the better way to go. Is there a sense that people are going robotic just for the sake of going robotic sometimes?
I think to some extent, anecdotally, you'll hear people, say that they were told that it's the way to go. But when it comes to the patients we talk to, they went to it because they encountered a problem. As Tamara Bierker, our patient, talked about, she said that she had been told by other doctors that she'd have to wait weeks. She tells them she's struggling to swallow because she has a severe hernia, and they're saying, well, we have to wait weeks. We have to decide our path of our course of action. And then, in a desperate internet search, she finds robotic surgery and finds that, it's something that she can do immediately and have a much shorter recovery. So, I mean, it really, there's a big full gambit of options that come into that. But
and you, in your reporting detail where part of the robot, there'll be a burn, there'll be a piece of the robot that would fall into the patient, and the vast majority of time, the surgery will stop. They'll go in, they'll retrieve the item. But have you been able to compare that? We've obviously heard that similar situations that have happened in traditional laparoscopic surgeries when human hands are at play here. Which is more safe? Do we have enough sample size to know, or traditional or robotic?
Yeah, so when you're talking about the early models of robotics, you definitely have a sample size, and the experts will tell you that it's comparable. I mean, the patient outcomes are pretty comparable when you're talking about traditional versus the robotic. Now, the newer devices, the 2014 and beyond, the sample size is a little bit smaller. They're starting to get research back, but there's still an ongoing discussion about what your risk and benefits are when you're picking between traditional and robotic.
All right, David, great job. I appreciate it. Thank you so much. Coming up next, we'll have some local headlines, so please stay with us.